You'd be a candidate for an onlay if you have some healthy tooth structure. If you have a pre-existing crown or cap, we can't do an onlay because we have to utilize tooth structure that is healthy and that is already there. So if you have a cap that needs to be replaced for whatever reason, decay, doesn't fit, you don't like the way it looks, we would do another crown. But if you have a filling, something that doesn't encompass the entire tooth, again, my goal would be to save tooth structure and place an onlay. The onlays that we use are all ceramic or porcelain. There's no metal. We don't use any metal in our practice anymore because there's just no reason to. With a porcelain onlay and all ceramic or porcelain restoration, we can be very aesthetic. They're going to look like a natural tooth, and even better, and we don't compromise the aesthetics that a metal-based crown certainly would present.